working through this test kit.
Thank you, Allison, and I'm so sorry that we had technical difficulties. I really appreciate you covering, and yeah, thanks everyone, and welcome to our session this evening. I had to come all the way from British Columbia, so that's what the problem was. So hello, Mark. So hello. So today we're going to talk a little bit about radon gas and the program, and so it's about a 30-minute talk, and you'll have lots of opportunities to ask questions. And we'll be monitoring the chat. So there's two ways you can ask questions. There's a Q&A, and there's also a chat. And I'm assuming there might be some people on the phone this evening too. So if we will read out the questions. We're not going to assume that you can see them. We'll read out the questions before we get going. And when we answer them. So feel free to jot a question down as it comes up, and then Allison can either manage it in the chat if it's a simple question, or if it's a bit harder, then we can chat about it later. And it never ceases to amaze me how great questions are. Like last night, somebody asked me about greenhouses, and that's the first time I've ever heard that question, and I've been doing this for years. So I'm always learning from everyone who shows up and has new ideas. So we're going to talk about radon today. And if you've never heard of radon before, you're actually in really good company, because less than half of Canadians have ever actually heard about radon gas and can answer questions correctly about it. And we know that because Statistics Canada asks people, every time they do a census, they always have those extra questions for some people. And on that extra census questions, there are questions about radon. So after tonight, you will actually be some of those folks who can answer questions correctly about radon. So if nothing else this evening, we'll be able to ace the census the next time it comes around. So I'm going to talk to you about radon's impact on health. We're going to talk a bit about how to fix radon. And then the 100 Test Kit Challenge, nuts and bolts for your community. So where to go to get your test kits, where to put them in your house, all those sorts of questions. So I'd just like, before we begin, to say that Take Action is proud to unite members from across Canada, which encompasses the traditional territories of many First Nations, Métis, and Inuit peoples whose ancestral footsteps and rights extend beyond the colonial boundaries that exist today. And we respectfully honor these people's rights, history, and relationship with the land. And this evening, I'm joining you from the unceded Coast Salish territories of the Musqueam, Squamish, and Tsleil-Waututh in British Columbia. But it is nowhere near as bright and sunny as it pretends to be in the background of my university's picture. So radon is an odorless, colorless, radioactive gas, and it is the leading cause of lung cancer in people who don't smoke, and the second cause of lung cancer in people who do smoke. It's because it's a gas, it's inhaled, and when it's inhaled, it can break down. Radon, like uranium, is unstable, and over time, it kicks off a bit of radiation as it decays. Unlike uranium, which lives for a very long time in its metallic form, radon only lives for about 4 days. So after that short period of time, it decays and it gives off this punch of radiation. And it's the radiation that damages the delicate tissues in the lining of the lungs. Radon is designated as a known human carcinogen. That means that it's the best level of evidence that we have about carcinogenicity. I just went and got myself a cup of coffee. People often say, oh, does coffee cause cancer? And there's been all sorts of studies, and we don't really know, but this is not the case with radon. It's very clear that radon causes lung cancer, and that chronic inhalation over time is the event that needs to happen before that occurs. So it's not immediately dangerous to life and health. It is a gas, but it's chronic exposure to the gas over time that leads to the development of tumors in the lungs. And Health Canada has done some interesting math, and they estimate that about 3,300 people, by the latest estimate, die from radon-related lung cancer every year, which works out to be about 9 Canadians a day. That's not an insignificant part of the burden of lung cancer in this country. And unfortunately, I'm sure everyone on this call knows somebody who's had lung cancer. Cancer is the leading cause of death in Canada, and out of all the different kinds of cancers, lung cancer remains the one that kills the most. What we've learned over time, too, is that smoking and radon just don't mix. If you have high radon only, your risk of developing lung cancer is 1 in 20. So that's actually pretty high. If you are a gambling person, those are good odds. So it's not great, but if you have high radon and you smoke, your odds go up dramatically to 1 in 3. And this evidence, again, comes from uranium miners and other people who've been exposed to radon and are smokers. So they've been able to stratify and better understand the impact. And radon, together with tobacco smoking, has a sort of synergistic impact on the relationship to lung cancer. And this holds true for smokers, ever smokers, so people who have quit, and even people who live in environments with environmental tobacco smoke. So if you've already taken steps to improve your lung health by quitting smoking, we really encourage you to reduce your radon level, because this will have a significant impact on your lung cancer risk. The World Health Organization also concurs with Health Canada's estimation, although they phrase it a bit differently. They suggest that smokers are estimated to be 25 times more at risk from radon than non-smokers. So where would you be exposed to radon? Well, that goes back to the nature of what it is. It is part of the natural decay chain of uranium. Canada is a uranium-rich country, and there's uranium in the soils and rocks all across this country. Some parts of the country have more uranium in them. We have a uranium mining industry still, but still there's uranium ubiquitously. And all the time it's decaying. And that means that all the time radon gas is being generated. And unlike metals, which stay in place when you put them down, gases like to move. So they move from colder areas to warmer areas, from denser areas to less dense areas. Gases got to do what they got to do. And unfortunately, this means that radon can come from the soil into homes through cracks in the foundation and sidewall, gaps around the pipes, and through sump pumps and other features such as that. Radon does dissipate outside, but the solution to pollution is dilution, of course, and outdoor the air doesn't matter. But it's indoors where we're mostly exposed to radon, and it's slightly heavier than air, and it's coming in through the ground. So we tend to be more concerned about lower levels and basement rooms and areas where people spend time. In Ontario, we have done a number of communities through this 100 Test Kit Challenge. And I apologize, I've only ever lived in Toronto, so I don't know the geography of Ontario too well. But many of you will recognize these communities and the metric here. So the axis on the left-hand side is the percentage of homes in Ontario whose homes have tested above 200 becquerels per meters cubed. And that is the Canadian recommended guideline for when you should fix your home. So you can see there's quite a spread from less than 5% in Baden all the way to Mallory Town, which is over 30%. And this is not surprising. In other parts of the country, we also see this variability, in fact, even more. In my province, it ranges from less than 5% all the way up to 70%. So the key findings from the work that we've done to date is that there's big differences in the rates of high radon in different communities within provinces and actually across the country. And that 90% of health regions have homes that have high radon levels. It might be just one or two, but everywhere we've looked, we've found at least a few homes above that guideline. So there's really no part of Canada that is radon free. And unfortunately, you can't predict. In some cases, in some subdivisions, there's homes that are fairly adjacent and one will have high levels and one will have low. So the potential of radon in the soil itself is only one factor. How the home is used, how high the home is, or how many levels the home is, how well it was built, how well that foundation was sealed, whether or not a home has been tightened or sealed up for energy efficiency, the amount of insulation, if you're one of those people that sleeps with windows open, all of those variables can impact radon levels. So the only way to know if there's radon in your home, because again, it's a colorless, odorless, radioactive gas, is to test. Okay, Allison, how are we doing for questions? Does anything come up that we should talk about health-wise?
Yeah, we have one question.
Sure.
North Kawartha is situated on the Canadian Shield. Can the radon gas come up through the shield? Are we less likely to have radon gas in this geographical area?
Well, I am not a geologist, so I don't know the answer to that question. Mark, you might have some information about the geology of your region.
Yeah, sure. I can fill a little bit in, but I'm not a geologist either, but I can fill in some things from, I guess, from experience through the building code. Just north of North Kawartha is an area called Faraday. Faraday's an area that the building code recognizes as having radon. And so it's actually part of the Ontario Building Code that if you build a house in Faraday, that you will have to put at least the I guess it would be the level 1 radon mitigation in, and then test as soon as you have it finished, and then again test a little bit later, see whether if you do need to use the mitigation, that it's working. So we do have areas in Ontario on the Canadian Shield that have radon in their basements, and like you said, in all likelihood, it's all across Canada. I don't think it would be different.
Okay, thank you. So where do you come in contact with radon? Where is it a concern? Well, homes, because more and more we're spending our time at home. What the pandemic really showed us was that many people spend 70 to 90% of their time indoors. And then of that, there's an increasing trend towards people staying at home. Maybe they're working from home, or they're lucky enough to have retired. But in general, more people are staying in their home. So this is where you're likely to be the most exposed. The next is schools. And some kids spend a lot of time in schools, in before and after school care. And not all schools are new and fancy and have great ventilation systems. There's still underground classrooms or basement classrooms, particularly in elementary schools. And in the United States, they have a much more robust program around children and radon exposure. Children breathe faster than adults. They have a smaller body size to mass ratio, and their cells are still dividing. And those are the kinds of cells that are more vulnerable to radiation. So in the US, they have a different program where they really address schools. In my province, we have one health region that's testing all the schools. I think in Ontario, there are some as well. I'm sorry, I can't comment on whether yours is, but you can ask those questions of the people that work in your schools and your school district and see whether or not places have been tested for radon, because it just makes sense. And fixing big buildings is often simpler than it is to fix a home because they have integrated HVAC systems. So really any building that has contact with the ground has potential. And I can tell you that Health Canada has already tested all the workplaces that it's responsible for. So workplace testing is yet another step that can be done to reduce exposures at work. But Health Canada estimates that the majority of radiation exposure that people get from radon occurs from their home. But Health Canada does recommend that all buildings be tested, and that includes workplaces. So how do you test for radon? Well, it's actually incredibly simple. You get a little device. So we're going to send you a device as being part of this test kit program. It's free. It doesn't have batteries. It's called a passive detector. So it's a one-use thing. You open the plastic bag, you put it down, and you leave it for 91 days at least. So this is called the 100 Radon Test Kit Challenge, because we give you 100 free test kits for 100 days. Now, if you went to buy something like this, it would be between $40 to $60. And then you'd have to mail it into a lab where it's read afterwards for the radon level. But the beauty of this project is you don't have to do any mailing and you don't have to pay. And we just really appreciate that people are interested in testing, and that's part of the program. And so you might ask, why do we test for 91 days? And that's a really good question. And that's because indoor radon levels fluctuate a lot over the day. So I have a digital monitor in my house, and when the kids come home, they like to look at it because it changes depending on things like weather, whether or not the furnace is on, if the windows are open. All sorts of variables influence the radon levels. So over time, it can go up and down. And so we don't want to pick one point where we have an erroneous measure where we either overestimate or underestimate your risk. So we recommend testing for a minimum of 91 days to make sure that we just have enough time so that we can get an average level. This is what the test kit looks like that you're going to get. So this is actually, even though it looks pretty simple, it's the most accurate kind of testing device out there. So, people often say, what? This is not rocket science. And it's true. It's not rocket science. It's radiation science. And the air in your house just flows through that little device. It's plastic. It's non-toxic. It does not accumulate any radiation at all. So you put it out, you got to take it out of the plastic bag. We've learned over time that taking it, people need to know this step. So that's basically starting it. There's no on button and no batteries. And I'll show you where to put it in a minute, but you just leave it. And then after the 91 days, you're going to put it back in an envelope and bring it back to where you got it and drop it off. Sometimes people get two of these in the mail. And that's not because we want you to give it to a friend or put it in the garage. This is for quality control. So the companies that make these make thousands of them, and we want to make sure that they're consistently accurate. So if you do get 2, we'd like you to put them together at the same space. So you're helping us with quality control when you get 2. So you will get a reading from a lab that is mailed back to you. And there's an image of what that looks like later on in this presentation. So the unit that we use in Canada is a becquerel per meters cubed. It's a different metric than what they use in the United States. So just to say, if you've bought something online from the US before that will help you test for radon, it measures in picocuries. That's again, it's named after Marie Curie. It's a very different unit than the becquerel, which was named after Henry Becquerel. So there's just different ways of counting alpha particle radiation. In the United States, their recommended limit for testing and fixing a house is 4 picocuries. For us, it is 200 becquerels per meters cubed. So those are very different scales. So just a flag, in case you're online looking for information, you see these low numbers, 4, and then your house is 50 becquerels. Those units are not comparable. So if your home is around 200, this is when the government urges you to consider mitigation. If it's above 600, they're going to urge you to mitigate sooner, because the greater the concentration of radon, the greater the likelihood that lung cancer will be developed. So radon levels can be successfully reduced. This is really good news. It's far easier than quitting smoking for those of you who have tried to quit smoking. Radon levels that are also very high can actually be very effectively lowered. So if your home is above 200 or if your home is above 1,000, it's the same technique that's used and it's as effective. What we do recommend, though, is that you try to get your home below 100. And that's because there's still a 16% increase in lung cancer risk for every 100 becquerels. So we really want to get as low as we can in homes when they do mitigation. A radon measurement of 199 is not a moment to celebrate. A low level would be around 100 or 50. My house averages around 70, but sometimes it spikes up to 110 because I will have this digital monitor that I can watch all the time. And you can buy these. They're about $250 if you like, and put it in your house. But they're not a recommended certified device like the little simple puck that we're giving you. So radon gas levels are reduced by installing a radon mitigation system, and I will show you an image of that soon. It is a system that has been tested for the Canadian geoclimatic conditions, so it is tailor-made to make sure that Canadian homes have radon that's reduced. But it's a bit different than what they do in Europe. In Europe, sometimes the stones that are used to build buildings actually have radon in them and can emanate into the building. So fixing buildings in Europe can be more complicated because the building materials themselves give off radon. In Canada, we don't have that problem. Our radon predominantly comes from the soil and sometimes in some places the water. And the research that we've done, because we want to make sure, shows that certified radon professionals can reduce levels by over 90%. And because it's a colorless, odorless, radioactive gas, and you can't see or taste or smell it, it's really important that you talk to a professional if you need to mitigate your house. Anyone can come in your house and do this and tell you and sell you a bill of goods and tell you that you're done. But the reality is you want to make sure that somebody that's taken the government certified course is the person that comes and fixes it for you. So this is what a radon mitigation system looks like. So if your home does test above the guideline, this system is fairly straightforward. So again, I'm the epidemiologist on the project. I'm not the certified radon professional, and often we have someone come with us to answer questions. So I will answer the questions as best I can if you have them about the system. But it is relatively simple. It includes a pipe that goes to the underground of your house. It's called under the slab, and it basically sucks the gas up through the pipe, and it's actually a fairly thick pipe so that the gas doesn't escape in your house. It uses a fan and it draws the air up and out either through the sidewall or through the roof of a house. So it's a pretty simple system and it's fairly simple to maintain. And overall, the energy draw from that fan is quite low. And the good news is that all homes can be fixed. Townhomes, standalone homes, and we even have sometimes mobile homes that test above the 200 becquerel guideline. So this is just some pictures of what they actually look like in real life. I have to say they're not the most glamorous things, but they're usually tucked away somewhere in a basement. And yeah, they're really effective at doing what they do. And the technical term for this is sub-slab depressurization. And people always ask us is, what if we need support? So you are in the best province for radon mitigation, I have to say, because you have a fantastic program that I'll talk about in a minute. But there's also financial support for home mitigation through the Canadian Lung Association. This is a new program, and it's a grant to help people across the country afford radon mitigation services. So we've done an assessment of what radon mitigation costs in different provinces. On average, across the country, it's between $3,000 to $3,500. Although if you have a big house with lots of different slabs and fancy architecture, it might cost you a bit more. But to help offset the cost of mitigation, there is this Lungs Matter program. And in Ontario, you also have the Terrian Home Warranty Program. So if you have a new home and it's within the 7 years that you've purchased and live in that new home, radon mitigation you can have it covered under your home warranty. You have to have that 91-day certified test to do that. So if you are the owner of a new home and you are testing as part of this program, it behooves you to find out a bit more about your Terrian home warranty, because that's actually quite unique. So if you want to try to find somebody, so you can test on your own using our certified tests. That's easy and straightforward. You can also hire a professional to test for you. But again, while you can try to mitigate your home yourself, if you're a super handy person, Health Canada does have a guide, but we do recommend that you call a professional. And so this is the Canadian National Radon Proficiency Program's website. And if you go to that, you can type in your postal code, and it will tell you who a certified radon professional is in your area. Now, I can't dial it up and show it to you. Ethically, you have to go there yourself and look it up yourself, because I can't be seen as predicating one person's services over the other. But there are people in Ontario that are trained to do proper mitigation. So just to talk a bit about your building codes. So the municipal radon option 1 is the rough-in soil gas pipe. So that means that many homes in Ontario are, and I'm going to lean on Mark here because he'll probably know when these were enacted. They already have that little pipe that goes from above to underground in the house. So that requires no drilling of the slab. In municipal radon option 2, there's a barrier, a plastic barrier underneath that is sealed, and then up the sides, and that helps prevent the gas from coming into the house. And then there's some municipalities that have option 3, where things are sealed, and then they already build those systems in. So Mark, do you want to step in here for a moment? Do you know if there's community offhand which communities those are, or is your community one of these?
Yeah, I'd like to just talk about it for a quick second. It is in the building code, just like you're reading it. There are many communities that are starting to do that. There's only 3 that are officially listed in our building code, but many other communities have, through programs like yours, done some testing. And the building code references or says, if a municipality knows of the situation or knows that radon gas is present in the area, then we can start. That gives me the opportunity to start requesting it or putting it in a bylaw that we will have it as well. So it was one of the reasons that I was interested in your program, is to see if we can get some established data around our area.
Oh, that's great to hear. Okay, that's fantastic. In BC, I believe next year they're moving to everyone being more like your option 3. But yeah, we had a similar system where people needed that evidence. Okay, we're jumping around here. Sorry. Okay, so this is the nuts and bolts. My presentation wants me to keep going here. So this is the nuts and bolts of the 100 Test Kit Challenge. So thank you for the building code update. So likely some homes in your community already have that pipe, which again would make it simpler to mitigate. But if you don't, it's okay. The mitigation professionals know what they're doing and they know how to put the pipe in. So there's 30 communities that are testing this year across Canada that have high radon potential, but there's been not a lot of testing done. And so how does this 100 Test Kit Challenge work? in your community, there's really 5 steps. So you go get your detector, and then you read the instructions of where to put it, and we'll talk about that in a minute. Then you log on to this Radon Test Kit Challenge.ca to enter a start date, and then you fill out a little survey in the beginning. And then after 100 days, and we remind you, you log back in, and then you enter the end date and you complete a survey. Now, why do we care about onboarding and offboarding people? That's just the way that the test works. We need to know how many days you left the test out. So it can be, as long as it's over 91, it's good. And if you're one of those snowbirds that gets to the joy of going to Florida, and you're not going to make it back in time for 91 days, that's okay. If it tests for 120, it can test for all up to 365 days. We're trying to make it easy here for you to give it back. But if you're not here when the test season ends, you can simply mail it to the lab yourself. So that's part of why we need to know, though, the date is because the way the test works is the radiation goes through the device, it pits the plastic. That's how strong the radiation is that comes off of radon. It's strong enough to make little dents in plastic. And then they count the dents and they average it over the amount of time. So we don't want to underestimate or overestimate your exposure. So we just need to know how many days it was that you had that test kit out in your house. And so you go and pick it up from one place, and then you come back with the envelope and you give it to the same place, unless, Mark, something happens between the beginning and end, and we have to change it, and then we'll let you know. And that's why we collect some personal information so that we can remind you to bring it back, because I can't even remember what day it is myself. So I always need people to help remind me of things. So maybe you're the same. We'll remind you to come and give it back, and then we'll send them to the lab for you. So you're going to get this device that comes in an envelope. You're going to take it out of the plastic, and then where are you going to put it? So it's a good idea to put it in a place where you spend a fair amount of time in your house that's closest to the ground. We don't want to know the worst radon that you have, so please don't put it in a crawl space. We want to know what you breathe. Then that's because in public health, again, we want to know what your average exposure is, not how bad your home actually is. Don't put it next to a window. That'll give a false reading because there'll be too much ventilation. So a good place to put it is next to your bed, in a basement area. If you watch TV down there, a child's bedroom in a basement would be a great place, or a rec room. Just someplace that you spend about 4 hours a day is usually a good spot. And hopefully you are getting 7 to 8 hours of sleep. So again, a bedroom is a good idea, but the one that's lower, closer to the ground. If you do your second level and the level comes back, it's likely that the levels and the lower levels of the house are higher. So you might as well, while you have the test now, get it and then put it in a place where you're going to know what your average is closest to the ground. So here's some examples, and this is just a slightly different kind of test that we've used other years. That's like a canister. So that you put them next to a couch, in a home office is usually good, or near a bed. And again, these are non-toxic. If it gets moved, if someone helps you tidy up and they put it somewhere else, just go get it and put it back. Sometimes kids play with them. That's okay too. They're non-toxic. We have had 2 dogs chew them in the last while, and that's not great. So if that happens, let us know. We'll send you another one. It's not going to work if it's been too chewed, because that plastic layer on the inside is really important for the analysis, but it's not going to hurt your dog. Kids do play with them. They have ended up in toy boxes, but just go get it out and put it back. It's not that sensitive that a few hours or a few days even in a toy box or a drawer is going to cause a problem. But maybe just let other people in the house know what it is. I had a person put it in the fridge because they thought it was cheese. One of those like little red cheeses. They thought it was a black version of the cheese. So not in the fridge. That's not a useful place. So when you log on, and all the information comes on an envelope, you'll see the envelope, so you don't have to write any of this down. There's a start survey and then the end survey. And again, that helps us understand a little bit about when you started, a little bit more about your house, and then when you finished. And we want you to complete the start form as soon as you get your test. And we have a program to run in lots of communities that are doing this year. So it's a really good idea for you to start as soon as you get the envelope. Just take it home and open up the plastic and put it out. You don't have to think too hard about it. Certain fields are required, though, for you to be able to have your report emailed back to you. So if you're somebody who doesn't use email, or you don't use computers, you can let people in Mark's office know, because we also have a pen and paper survey, because we recognize that not everybody has easy access to the internet. We've done these on some of the Gulf Islands in BC, and internet there is not really an option for most people. So you don't have to have the internet to do it. We can help you do it otherwise. So some parts of the survey are optional, including the housing survey that we do for research purposes, like how you heat your house, because different heating things influence the way the radon moves in your house. You don't have to do those if you don't want to, but we do need to have some information about you so that we can get you your results. Again, if you get 2 detectors, you haven't won the lottery. It's just our quality control purpose. And we will want you to put in the serial number of the second detector too, so that we know why there was 2 from your house. So whether you also have to bring all of them back. So if you have the 1 or 2, put them back in the envelope and take them to the community collection point, which I'll explain to you what that is in a few days or in a few minutes. So this is the radon monitoring report that you will get mailed to you. This is your own private personal information. It's not made accessible to anybody else in the community. You'll have your own report. And again, or it will come in the mail if you don't have the internet. And then at the end, we do an aggregated community report. So we take all the information from your community, we put it all together. So this was a test kit challenge we did a few years ago in Peachland, BC. And the interior of British Columbia has some high uranium concentrations in the soil and high radon levels. So here we found about 40% of homes tested above the 200 becquerel guideline. And this is, you'll get a report, it'll look like this for your community. And then on the back side, it has information about mitigation. So it looks like, just to be clear, Mark, there is 3 places where people can get their tests. This is correct?
Yes, that's correct. So we've chosen to use our town office. That's where I work. And possibly, if you want to be more specific, the building department, which has a side door. And then we have a library in Apsley. And that's going to be probably the only place that if you have to get it on a Saturday that you're going to be able to get it, because our other 2 places I don't think are open. And then we have a library in Woodview, and Woodview's library is open, I think every other day kind of a thing. So you have to make sure it's you go on one of the days that it's open.
Thank you for having it available on Saturday. Because that's often a complaint that we get, that people can't get there during the week, or they can't get there during the hours.
Yeah, that was specifically why we only had the one library that's going to be for sure open Saturdays, I believe. So if you need a Saturday pickup, then the Apsley Library is going to be your best choice.
Okay. And then at the end, you'll also take them back to the same place. So you have from now until December 8th. And then afterwards, you pick it up March 18th to 22nd. So again, that's also your understanding too, Mark?
Yeah, I think is December the 8th a Friday. Did we put it in here as a Friday? But I think we're going to do the Saturday as well. I have to just look and see. Just make sure that we know that the Apsley Library will be there it is. It says Tuesday to Saturday. Perfect. Okay.
Yeah, great. And again, thank you for that. And then if you have questions, the info at Take Action or this phone number, it will be on your envelope. You don't need to write this down. No question is too weird or small. It is definitely, we get all sorts of questions, and we love talking to people. To be very honest, I could nerdily talk about radon all day and testing. So don't hesitate to give us a call. Oh, and I think that's it. So I'm just going to go back to where your information is about the pickup. And Allison, do you have any questions for me?
Yeah, there's a few here. If you have blasted rock to build your home, does this increase your radon?
Does that mean the rock that's underneath, like the gravel that was put underneath the home? I'm wondering.
I'm not actually sure. Yeah, it just has blasted rock to build your home. I'm assuming it's part of the foundation.
Yeah, so a few things on that. Maybe, we don't know. in BC, one of my pet projects soon, hopefully, we'll be looking at gravel pits, because gravel has a lot of surface area. And if there's high uranium concentrations in gravel, we're really just creating a radon problem where we don't need one. But the slab on grade houses can also have elevated radon. So the answer to that is I don't know. And I think you're going to have to test to find out. So I would still test if that's what's underneath your house.
Okay, we have another one here. My home has an air exchanger. Do I need to shut it off during the test period?
No. So great question. Just use your house as you would normally use it. If you have an air exchanger and it helps to dilute the radon levels in your house, great. It just means that your house will test lower. So use your house as you normally would. Open the windows if you open them at night. I'm sure your region is colder than mine. I sleep with my windows open. Maybe people don't there because it's too cold in the wintertime. But just use your house normally, come and go normally. Because again, we just want to test where you live and how you live.
Here's another one too. Are homes with no basement and no concrete slab, only a crawl space, prone to possible radon accumulation?
Yep. So if there is earth underneath your home and it's not sealed, so yes, there's all sorts of different factors at play there. But yes, slab, gravel, dirt, all of those, again, these are natural processes that include rock and soil. So it doesn't really matter where it comes from. The issue is the radon can come through, especially with concrete slabs too. They can crack over time. Sometimes even in the newer homes where the plastic is put down for sealing, there can be holes in the plastic. So you really, again, you can't guesstimate. You kind of have to test to know.
Here's a good one as well. Most homes have sump pumps, which I think are essentially in the holes. There are holes in the concrete basement floor. Would radon then most likely come from there?
It is a conduit into the home. And one of the parts of radon mitigation that people do is they can put sump pump covers on sump pumps too. That can be part of a mitigation process. And where I live in British Columbia, we don't have sump pumps because I'm kind of on a hill. But I know that sump pumps can be an entry point for radon, but sometimes it's not the only entry point. So there might be, if there's radon in the soil under the sump, it's probably in the soil around the sides of the house too. So it's just one conduit of possibly many that could come in.
Okay, and then I have a few asking this, so I thought that would be a good thing for you to answer live, Anne-Marie. There's a few that are going to be gone over the winter, and some have sealed, like they closed down their house for the winter, and they're wondering if it's worth picking up a test yet and then testing when they get back in the spring.
I guess it kind of depends. Mark, are you guys running out of tests?
Yeah, we have actually given away had people sign up for all of our tests. And I was going to ask you that if you want to talk to how we normally deal with, we have people on a waiting list. So if some people don't pick their test up, we may get a hold of them after. If we can talk about that, that would be a good thing. I think the other thing we should note is that in North Kawartha, probably maybe 60 or maybe more than that, 70% of the buildings built here are cottages, which may not be used over the winter. And that could be part of that question.
Right. Yeah. So if you don't spend the winter in your home and you spend the summer in your home with windows open and coming and going, then maybe you want to leave your test kit for someone who does over winter. And because we know homes have more closed conditions in the winter, that's part of why we test for radon. The only wrinkle to that, though, or caveat, is that more and more people are sealing up their homes for air conditioning purposes. And in the US, interestingly, in places like Arizona, radon levels are higher in the summer because of that. But if that is the case, if you only live in your house over the summer, you might want to consider testing in the summer because that's the air that you're going to be breathing.
Okay, there's another question here, Anne-Marie.
Okay.
I spend all my time in the kitchen. Does cooking affect the test?
You don't want to put your test kit next to your stove because moisture can be a problem. It's also why you don't want to put it in the bathroom because water molecules are big and they can impede the flow of air into the little device. So as long as it's far away from I live in a tiny house in Vancouver, so it's a bit of an issue for me. I had to put my radon detector away from my kitchen, and I also have a very powerful exhaust fan. So you don't want it near where the exhaust fan is going to be sucking air up and out, because again, that's not really a good, you don't spend all your time in your house standing right in front of the exhaust fan. So I'd put it, a ways away. You could still have it in the kitchen, like closer to a table, but not right next to the stove.
Sounds good. And then there's another question here related to the cottage. I can't talk today. Cottage things that you were talking about. Does it matter if the space you are testing is below zero at times? Our cottage is seasonal, but we do visit it frequently in winter, and that is where we are testing.
Yeah, great question. No, temperature doesn't impact it. It will impact the ingress of the gas, because what we see is when people turn their furnaces on, the radon level goes up. So if your house is cold, what might be is that the radon is not drawn up into the home quite so much. So that just is something to consider. But no, cold, there's nothing technical or electric about this little thing. It just sits there, and whatever air is in your house just goes through it, whether it's hot or cold. It's just steamy air is not great, but cold air is fine.
Sounds great. Another question here. If you have exposed rock within the finished basement of your house, how would radon be mitigated should the levels be or test high?
That is a great question. So here in Vancouver, in West Vancouver, there are some amazing homes where the rock is architecturally featured in homes. And my answer to that is that you're going to have to talk to a professional. I think it depends on, again, if it is a feature. One of the homes, I believe, put like a Perspex box around the feature. But I think it really depends on, is it just happens to be a rock in your basement, or if it's, the shiny part of your house that you want to profile when people come in. I think there's probably a difference. So a radon professional would be a better person to ask that question to than me.
There's someone just asking if you could repeat your comment about summer versus winter radon levels.
Sure. So historically, people have said, oh, radon's a problem only in the winter because that's when people close all their doors and windows, and that's it. In the summertime, everyone opens their windows and doors. But whoever said that obviously hasn't spent time in Canada in the summertime when it's really hot, because many people seal their houses up now so that their air conditioning isn't wasted. So what we're seeing, interestingly, is that the levels between the winter and summer aren't quite as disparate as was originally thought. So if you have a home that you've sealed up to make sure that your home is nice and cool in the summertime, and you do that by sealing all the cracks and gaps, you may also be sealing radon gas inside. It depends on how your air conditioning system is. Maybe you've got a lot of mechanical exhaust or not. So again, everybody's systems are a bit different. There's split systems, and there just hasn't been enough research on summer radon, because this phenomena this realization of radon is a different, it's new. Again, in Arizona, they tested homes, and that's where they found that homes were higher in the summer than they had originally thought. Not everyone is just able to open their windows. I mean, we have bugs here. I don't know about you guys, but I can't leave my windows open at certain times because the mosquitoes come in. So yeah. I'm assuming there's bugs in Ontario too. Yes. And Manitoba.
Yes, definitely mosquitoes. So, currently my basement is not used, but I intend to have living office space there in next year. Yeah. Should I put the detector there so I can mitigate before I do this?
Yeah, probably that's a good idea, especially before you're going to do a mitigation, like before you do any renovations. And, on that note, I'm going to say that if you have recently done an energy retrofit, if you've used one of those Canada Greener grants and you've changed the ventilation pattern in your home quite a bit, because some people see quite dramatic improvements in their energy bill because their houses are all sealed up. But the reality is you can change the ventilation pattern of your home and be trapping certain gases and particulates inside inadvertently. So if you've done that recently, it's also a good time to test. And I'm working on seeing if I can get the Canada Greener grants people to really give people radon test kits for that exact reason, because you can really change levels in your home of not just radon, but all sorts of things. Moisture is another one as well.
There's another question here too. Will the results provide an actual number? I have already tested previously and had a level of 113. Do you have some simple ways to decrease the level between or below 100?
You will get a number. 113 is a pretty good number, actually. That's a number that I, my digital monitor goes up to 113 and then back down to 70-ish, and then sometimes it's 50. So that, it's great that you're testing again. Radon levels can change over time. In Alaska, they recommend people test for radon after earthquakes because things change underground and stuff moves. So, and gases suddenly have pores and spaces where they can go up through. So it's good to test, every 5 years is what's recommended in the United States, because you just never know how your house is settling or changing over time, or if you've made changes.
This question's for Mark. There's just a few people here that were hoping to pick it up before the 4th of December because they're going to be gone after the 4th. Is there a way they could come in the next day or two?
Good question. Unfortunately, the test kits are at the town office, and I'm not going to be there tomorrow, but I'll be back Monday, which is when I was going to distribute them to the other 2 libraries. So I don't know that I have a way of doing that.
And that's the township office or building? Yeah, one of the respondents asked about the township building, wondering if they could come on tomorrow, like on the Friday, to pick it up. Would that be recommended?
I can, there's a possibility that we could do one or two, but I don't want to inundate them when I'm not there. It would be very nice to do to my staff to invite lots of people to come over when I'm not there to do what I've said I should do. So there's a chance that I can try and get a hold of somebody, see if we can get it one test out of a box, but we don't have the list, I don't think, yet. We're going to put that together for Monday to distribute with them. So maybe I'll leave a message and you can try and see if my staff can go find stuff in my messy office and find you one. I guess I'm saying we'll do the best we can.
Yeah, no, that sounds good. I just thought there's like 3 or 4 asking the same question, so I thought I'll let you answer and speak into that. So, there's another question here for you, Anne-Marie. So I spend most of my time on my main floor. However, you said if levels are evident, chances are the basement will be higher. So why not test in the basement?
Well, if you don't spend time in your basement, then that air is really not relevant. And lots of things can happen between the basement and your next floor. So we really, again, we're not trying to find radon in your house, because there probably is some. There's some in all houses. We just want to know what the average level is that you breathe in. If you think you're going to finish your basement, though, or you're going to make a room for your kids or your grandkids, or you're going to end up retiring and spending your time sewing in the basement, then you'd want to know what the basement levels are. But we really just want to know what your average exposure is on a day-to-day basis, just in the way that you use your home normally.
That's it for the questions. I was going to add one more thing, Anne-Marie, just on the information sheet that you'll get in the envelope. If you miss the drop-off date again at the collection time, you'll actually mail it to our office, and the address is listed below, because we keep track of that just in case the reports are lost and we have to do some research to find the reports, and it's easy for us to access that, and then we can track the serial numbers and all that.
And this happens a lot. So this is why we take the information from you in the beginning, so that we can make sure that you're able to remember to go take the test, hand it back, get it back. If you forgot the detector number, all those things happen. So we're here to help you. And we really do encourage people to reach out if they have any questions. What I haven't been asked, interestingly, is about other health effects from radon gas. So I'm just gonna say that question out loud. Are there any other health effects from radon gas? And the answer is we don't know. And that's just the way, an artifact of how the data was collected. So over time, it was Canadian miners along with French miners and people from Europe who worked in uranium and fluorospore mines. It was their lungs that developed the lung cancer. And it was pretty clear that mining in those sectors was at first they thought it was the uranium, but then over time they realized it wasn't. It was actually this gas that was coming from the uranium. But they didn't spend a lot of time looking at other health outcomes. So people often ask me, what about COPD? And what about other kinds of cancers? And it's possible. And there are places in the world where they're trying to look at those relationships, but it's not ethical for us to expose people to different levels of radon gas and see what happens, because we already know that it's bad. So there's things called correlational studies where they take what the average exposure is, and then they look at the disease rates in certain communities. So at Harvard right now, they're looking at issues like COPD and radon levels. But those studies don't follow people over time. And so the best evidence comes from longitudinal research where we know what people are exposed to and we know how long they've been exposed to it. And that's the kind of evidence that's been used to say that radon causes lung cancer. So again, you can look stuff up on the internet and find all sorts of information, but the answer to those questions are, we don't know yet, because the evidence isn't really good enough for us to say anything else than radon causes lung cancer, which is pretty bad. So we're just kind of going to want to go with that, but it's possible that it causes other things too. Yeah, Mark.
Okay, I've been asked lots of questions, but I think you've answered most of them. But there was two questions that I had a conversation about that I had no information on. And is there some correlation between time and the radon exposure and, like, number of hours per day for so many years, that it's worse, or is it shorter or longer? Does it matter?
It depends on a few things. So it depends on the level. So in the mining studies, the lung cancer incidences began between 5 to 15 years. And again, this is how they measured how long people had been working in those mines, and also the radon concentration. So it's the higher the level, the shorter the time, essentially, but it doesn't happen overnight. And that's why you have some time to fix your home. If the levels are high, you don't have to evacuate your home. We had a school in PEI. It didn't test through our program, but I felt so bad because they got the radon test result and then people panicked and they evacuated the school. So it's not like that. You have time to reduce your levels. Sometimes if your level is over 200, people will maybe start to open windows a bit more and do a few other things. Some people go by digital monitors. And then they see, because what you're going to get is a number when it comes back. You're not going to get a range that tells you how high. So you can go get a digital monitor if you want to actually be nerdy and check what the radon levels are. But that's why we give you a bit of time, so that you can spend the time finding a professional and spending the time getting it done right to have it fixed. But the higher the level, the sooner Health Canada wants you to fix, because the higher levels are that much more dangerous. And just on that point, like, I'll just finish this. So, 600 is where Health Canada says, yeah, you got to within a year. And in BC, we have some houses that are 3,000. So there are, sometimes people get bad news right away. And if that's the case, give us a call and we can help you navigate the next steps, because that is very high. Yeah, go ahead, Mark.
There's a chance that I forgot my question because I was listening intently to what you were saying. I wrote some down here, though. Let me see if I can pull it up again. Nope, it's left me. If it comes back, I'll
Here's one. Can I hang it from a wall? And yes, you can. So Health Canada has all these very particular ways, and you'll get this information. And if you go online, you'll look to see, where do I put my radon detector? But it has a little, slightly like a tiny handle. You can slip some string through it and pin it on the wall. And that's an acceptable way. So that kitchen scenario that was asked earlier, if you don't have a space that's clutter-free ever, like, if you got books and stuff and people on the kitchen table all the time, and you don't want to leave it there, you can just tidily hang it on a wall. And that's fine. The air will just move through it like it's like anywhere else. So that's often a good solution if you can't find a flat space to put it. Did it come back? Your question mark?
No, that's the fun part of getting old is that sometimes you forget them and they may come back in a day or two. I'm not sure.
Isn't that why we have children, so they can figure out how to get on the internet and remind us about stuff?
Yes.
Any more questions? But I think our hour is almost up.
Yes, it is. I was just going to remind everyone where to pick up, and the slide is still up there, so that's great, Anne-Marie. And that it's starting Monday, December 4th to Saturday. And then somebody just said in the chat here too, Mark, and I don't know if you could confirm that the library absolutely closes at 2 on Saturday.
Yes, it does close early, and on the bottom of the slide it says until Friday, but we're hoping that we can have them in the library on Saturday too.
Sounds good.
Yeah.
And I'd like to add one more thing if I could. I want to
Okay.
say thank you guys very much. This program was exactly what I was looking for. I also want to say thank you to all the people that have signed up and participated. You've made it a really successful program. I'm quite excited that we've had the turnout we've had, and I think it's wonderful.
Yeah, and thank you for hosting it. Now you've got an army of citizen scientists who are out there doing their part for science. So thanks everyone for taking on this experiment and helping Mark learn about what building code is right for your community and houses going forward. It's really important that we have folks on the ground who are helping take the lead on this. So yeah, thank you. It really helps when it's somebody in the city, because that way, you can actually make changes. So it's much easier this way. So yeah, thank you.
Well, it's been a good turnout. I'm very happy.
Yeah, that's great. It gives me another reason to come to Ontario and drive around to all the communities that have tested, because I've met so many great people. We've been doing this for 5 years now. And this year we're testing all the way from Mermaid, PEI, all the way to Victoria. Oh, and Newfoundland too. So it's coast to coast actually this year, which is quite amazing.
If you come in May, there'll be some bugs.
I got my deet. I'm okay with that. Okay, well, thanks everybody. If there's no more questions, I think we can probably end the session now. And yeah, good luck. And again, you'll hear from us again. We have sessions in the spring to help you interpret your numbers. So watch out for that. If you need questions, we have like open houses sort of like this where people can join and chat amongst themselves or with us and ask questions. And then yeah, all that information is on the envelope. You might want to take a picture of that envelope when you get it so that you have a record of it in case the envelope gets thrown out. That's a pro tip from me. So, okay.
Well, thank you very much, Anne-Marie, for leading this, and then Mark also for answering some questions. And thank you to the participants as well. So
thanks, Allison, for stick handling the beginning too. Sorry about the technical.
Well, that's okay. I tried. So all right. Thank you so much. Oh,
Okay,
there's one more question. No, yeah, the recording will be available. I'll just answer that. Recording it is being recorded, and we'll be sending it out to the next few days. So yeah.
Perfect.
Right.
Thank you, North Kawartha.
Yep. Thank you.
Thanks,
Bye.
everybody.
Bye.
Bye.